This one is the spleen, which is a wedge-shaped organ present in the left hypochondrium. As we know, the dimensions are given by the Harris dictum of odd numbers. So it is 1 inch thick, 1 inch thick, 3 inches wide, 5 inches long, 7 ounces in weight, and extends from 9th to 11th rib. The position is like this. Position is like this. If you see, it is in the axis of the 10th rib, 45 degree from the horizontal plane. Okay, what makes a 45 degree with the horizontal plane. There are two ends, anterior and posterior. There are borders like the superior border, inferior border, and here it is a hilum, or we can say the intermediate border. The two surfaces, the diaphragmatic surface and the visceral surface. Diaphragmatic surface is the smooth one, while the visceral surface is the rough one. Okay, there are two angles, anterobasal angle and the posterobasal angle. Anterobasal between the superior and the anterior end. This one anterobasal angle when there is any in spleen and it is enlarged, the anterobasal angle can be palpated. So it is called the clinical angle of the spleen. While this one between the inferior border and the anterior end, this one is the posterobasal angle, which makes it two angles. Okay, anterobasal and posterobasal. Then there are three ligaments. Okay, two ligaments which are connecting the hilum to the left kidney. Two ligaments, one connecting the hilum to the left kidney, which is called the lienorenal ligament, which contains the splenic vessels and the tail of pancreas. Another one which connects the hilum of the spleen to the greater curvature of the stomach, which is called the gastrosplenic ligament, and which contains the short gastric vessels. There is another ligament which is not attached to the spleen, but it supports the anterior end like this. It is attached, it is called the phrenicocholic ligament, which is attached between the cholic flexure of the spleen and the diaphragm. Okay, this is also known as the substanticular lenus. It is not attached to the spleen, it only supports the anterior border of the spleen. It is also called the phrenicocholic ligament. There are many impressions. The impression between the superior border and the inferior border, and the most deep, it is the gastric impression. The impression between the intermediate border and the inferior border, it is the renal impression. At the anterior end, there is the impression for the cholic flexure for spleen, means the colon. It is the cholic impression. The colon gives the impression. And here between the hilum and the cholic impression lies the pancreatic impression, which is due to the tail of the pancreas.